Marvin Plackett, and today is Thursday, August 13th. Greetings to all residents, to all staff, and to all guests. We currently have 9 active COVID cases at Episcopal Homes. 1 is a resident, and 8 are staff. And the resident lives at King's Crossing, and of course, all of the staff, they are home recovering. So that means that on our main campus, we continue to have no active cases of COVID-19. The additional staff person that had confirmation of COVID, they work at the gardens, floors 5, 6, and 7. And at the gardens, testing will occur today and tomorrow that had previously already been scheduled. And then there'll be more testing that will be scheduled for next week and maybe the week after as well, in light of the new confirmation of a case from a staff person. At Episcopal Church Home, all Episcopal Church Home residents and staff will be tested next week. That is yet to be scheduled, and this is a result of the fact that the state of Minnesota is allowing nursing homes to open up to more visitation. However, there are some carefully prescribed requirements that must be completed, that must be in place before that can happen. And one is that any nursing home must be COVID-free staff or residents for a minimum of 28 days, and then they must have mass testing completed during that period of time to ensure that nobody, in fact, does have it. So this is one of the measures that is being put in place where testing will occur throughout the entire facility of Episcopal Church Home next week. The 2 most recent staff to let you know that tested positive at the gardens for COVID-19, they had no symptoms, none. And of course, that is the mercurial nature of this virus, the vexing thing about this virus, among other things, and that is that one doesn't know if they have it. And of course, that means if you don't know that you have it, you could be spreading it. And if you're spreading it, you could be spreading it to someone who will get deathly ill if they contract it. And so that's why it's so important that we do the practice, that we continue to be vigilant with the practices that we know to do, because it is the best weapon that we have against this pandemic, and that is social distancing, staying at least 6 feet apart, wearing masks at all times that we're not in our apartments or our units or in our rooms, our offices. Outside is interactions is better than inside. Frequent hand washing. And if you have any symptoms at all, self-isolation, and then get tested and inform us. So those practices are the things that we know to do, and so that even if we have it but don't have symptoms, we are not likely going to spread it to anybody else. And if I don't have it, but you might, well, you're not likely going to spread it to me. If we are staying 6 feet apart, if you are wearing a face mask, etc., etc. So that's why we have to look out. We're in this together. We have to look out for one another. We have to care about one another. It's a community. And so we all have to be vigilant at all times. So like I said, the reason why I press this point again is because the last 2 positive confirmed cases of COVID at Episcopal Homes, both staff persons had no symptoms. They were entirely surprised to find out that they tested positive. Just a reminder that I have changed my communication practices for these updates. So now I'm communicating, I'm doing this update on Mondays and Thursdays, still at 1:30 p.m. both those days, Mondays and Thursdays. And then of course every Friday I'm putting out a written update that's a summary of the week for COVID-19 at Episcopal Homes. And remember that on our website, episcopalhomes.org, that we have a COVID-19 dashboard. That's an indication, it tells you and gives you an update of everything that's happening at Episcopal Homes at any point in time, and it's updated whenever there's a change. and you can see when it was last updated, the date and the time that it was last updated. And I know that it was updated this morning, for instance. And so it tells you how many cases we have currently. It tells you the percentage of positive cases from testing versus how many tested positive, total testing that is, versus the positive cases. It tells you how many tests are out there right now where we haven't yet received results and we're waiting results. So it tells you a number of key things. And so I said, like for instance, that we have 9 active cases. Well, right at the top it tells you 1 resident, 8 staff. And then it also tells you where those residents and where the staff were or are. I want to reference an article that came out yesterday in the Star Tribune about fitness. Fitness promoted as COVID-19 defense. So now, this is not as immediate as social distancing, wearing a face mask, frequent hand washing, and if you have any symptoms, staying home, of course, and not getting together in any large groups, etc., the things that we know. But fitness promoted as COVID-19 defense. Kimbers Cadeau, I'm not quite sure if I'm pronouncing that name correctly, never particularly enjoyed working out. If left to my own devices, I wouldn't do it, she said, but the 64-year-old cancer survivor is exercising almost daily now to reduce her odds of complications if she's ever infected with the coronavirus that causes COVID-19. Quote, "If COVID shows up, I want to be stronger," she said. And now jumping down a little further, Dr. William Roberts of the University of Minnesota, the American College of Sports Medicine, issued guidance Friday advising 150 to 300 minutes of moderate to vigorous exercise each week to reduce risks of severe COVID-19. Quote, "It doesn't have to be 150 to 300 minutes, Roberts said. If you can only get in 30 minutes a week or 60 minutes, it's better than nothing. The biggest thing is get off the couch." Okay? So exercise. And you know, not only does exercise make it, well, the words they use here is, promote COVID-19, so it helps with your defense of COVID-19. But not only that, exercise makes you feel really good, because when you exercise, of course, the endorphins and the adrenaline, they are flowing through the body, and they are feel-good natural medications that are in our body, and they just exist. You know, we have a pharmacy in our brain. We just need to tap into it, and exercise is one way to tap into that natural pharmacy. It really works. I do it every day. I guarantee you I feel so much better after I've exercised. Okay, let's see. And remember, of course, Anthony in the exercise room that we have and so forth, and the pool is going to be opening soon, if it hasn't already. You'll see the notices. And then there's walking groups that walk around our campus. So if you have any questions about this, reach out to Anthony in our exercise area, and he will be glad to spend some time with you to give you some suggestions, some guidelines, answer your questions, etc. So by all means, do that. Okay, so here we are, it's Thursday, and so like I said, I will not be back here until Monday. And so I wish you a very good rest of the day, wish you a very good weekend. I hope that it is meaningful, pleasant, and take care, everyone, and always employ the practices that we know to help keep us safe from the virus. And I look forward to seeing you on Monday. Bye-bye.